I hope everybody's having a great new year. This is Dr. David Cruz with White Coat Medicine Talks, and today we're going to be talking about, and we're probably going to be talking about this for some time, is the coronavirus. Now, as we know, this coronavirus started in China, and it's still growing and spreading pretty quick in China. And I want to talk about that because I know there's going to be some concerns in the near future as to us getting infected here in the United States as well. And so let's go ahead and talk about that right now. So let's kind of cover a little bit of what the coronavirus is. Of course, it is a virus, and as we know, viruses can spread very easily from person to person. They can spread if you contact something where that person sneezed or coughed or anything like that. And it varies from virus to virus as to how long it would be possible to get that virus if it was on something, on an object, and that you grabbed it and then you touched your nose or your eyes or your mouth or anything like that and then got that. Or if it's person to person, you can definitely get it. So if you're within a good range of 6 feet of somebody that's coughing and sneezing, then it's very likely that you can come in contact with that virus and actually become infected as well. This particular virus has been called COVID-19 now, and the name is just so that we can have a name to it so that they can differentiate it from something else and not just put where it came from as the name, because then it's gonna kind of give a bad name to that place. So they gave it the name COVID-19, and now we already are working on immunizations for this as well. So one of the labs here in the United States was given the genome. They figured out the genome, and within 3 hours they had something that could work as a vaccine. So that hopefully will go into testing. I would assume they're going to test it in China because that's where most of the infections are. And as far as we know, so far, over 70,000 people have been infected. About 1,900 deaths have occurred already. There's people from the United States that have been infected, and they had been in quarantine in China or in different areas, and then they've been brought here to some bases. We know that in Lackland there was at least one positive a couple of days ago, and I believe they were flying in some other people that are going to be quarantined as well that possibly had the virus but had no symptoms. So those will be in quarantine. So the United States is taking a lot of precautions as to what is going on with this virus, and they're trying to stay on top of it as much as they can get as far as the information from China. And whether it's reliable or not, that's a question that's been coming up quite a bit. Now, some are predicting that they're only kind of catching 1 in 20 of the infections that are out there, and that's concerning because that means that it can spread very easily in those people that are undiagnosed as well. So, because as with any virus, we have to know what's going on and how easy it could spread, and we have to stay on top of this information before it becomes a worldwide epidemic. For testing here, for now, we get a respiratory panel to test to see if you have any type of viruses or infections in your lungs and in your respiratory system. And that gives us an idea of whether there is a coronavirus. There is different types of coronaviruses, and COVID-19 is just a new one that was discovered and now named. However, they will test you for coronavirus. Now, the CDC has also made a test to test for COVID-19 as well, and they have certain labs that are testing for that, and they're trying to expedite to try to get more labs to be using that test as well. And so that's coming our way. Hopefully in the near future every lab would have access to that as well, so that we can quickly determine who is infectious. Now, for us, the main thing is taking care of yourself, precautions. Wash your hands well. Try not to get your hands and rub your nose, touch your mouth, touch your eyes, anywhere where you can get infections. Use hand sanitizers, and be careful if you are sick and you do have runny nose, fever, chills, or anything like that, which right now here would be more like flu symptoms, then get checked out. Go to your doctor, get checked out so that we can figure out exactly what you have so we can treat you and kind of put you away from the workforce if necessary. Usually I keep my patients out for 5 days while they get treatment for the flu so that they don't expose other people to the flu. And so we do that pretty much with every case that we see. And once you're diagnosed, at least you'll know whether your family needs to be treated as well or not. Currently, there's not much danger of this COVID-19 here. However, we have to stay on top of this, and on White Coat Medicine Talks, I hope that we can update you pretty frequently as far as what's going on, and that way you'll be on top of the information as well. For White Coat Medicine Talks, this is Dr. David Cruz. Thanks for joining us. We'll see you soon. Like and subscribe.